prior to the eruption of the teeth through the gingiva or your gums, it will cause an initial fluorescent yellow discoloration. So as much as possible, we don't advise the physicians would not advise the use of tetracyclines for kids 8 years and below because of this side effect. Okay, that's number 29. Number 30, the nurse has a correct understanding if she will follow or if she will do which of the following before starting anticoagulant to a particular patient. Okay, anticoagulant. You do understand the use of this anticoagulants if letter B. Okay, very good. Letter B, she will have to check for any signs of bleeding or bruising, excessive menstrual flow, and looking into the client's prothrombin time and partial thromboplastin time on his lab result flow. So this will serve as your baseline data or basis, especially so if your patient will have to start with an anticoagulant treatment. So you are aware that your anticoagulants are, ano ulit ang anticoagulants? Will you please define it? Bago natin tuluyang makalimutan, what is an anticoagulant? Anyone?
Prevents clotting.
Okay, so this is a medication that will prevent the formation of clots. Okay? Yan. So, that's number 30. 31, marami pa tayong encounters on anticoagulants sa ibang numbers. 31, Mr. Kim Mott is diagnosed with TB. One of his medication prescribed is Refam. Okay? To make the patient comply with the medication regimen, the nurse will inform the patient. The nurse will inform the patient of which of the following side effects of rifampicin. So what is the most common side effect of this medication? Is it the staining of the tooth enamel? It's responsible for pseudomembranous colitis.
D.
Okay. Letter Delta or Bravo, sorry. Delta or Bravo?
Delta.
Delta.
Okay. So if the patient's urine would turn into red, this is not a cause for alarm on your part as nurses because this is an expected side effect of the medication. So, wag kang magugulat doon na, bakit red? Ang red or red-orange ang color ng ihi ng pasyente natin. So, don't be surprised. This is not a cause of alarm. Okay? So, again, this is one of the most common side effects of the medication rifampicin. For the black tarry stools or black stools, this is more associated with iron supplements. Okay? Wait lang, mga anak. Mga classmates, sandali na nga, ihi lang ako. Parang awa. Okay? 2 minutes lang. Thank you. Ihi lang po.
Tugayo na. Kaso kanya 2 minutes ka umis po ni ma'am. Pita.
Number 32, the nurse genitalia practices drug or medication safety. Which of the following will be observed involving the use of thrombolytics? Okay, before we go further, what is a thrombolytic? Anyone? What are thrombolytics or what are thrombolytic drugs? Before we go further with the choices. Okay, so thrombolytic drugs are medications or substances that helps dissolve blood clots, okay, that can possibly occur in any of your vascular beds. So again, they are responsible for the dissolution of blood clots that occurs in any of your vascular beds. Okay, so that is a thrombolytic. Now, which of the following will be observed if you are to use a thrombolytic? Letter A, the client should have a bed rest at all times. The patient should abstain from fatty or salty foods, should perform oral hygiene before going to bed. IM injections are avoided.
Delta.
Delta, very good. Why Delta? Because IM injections are what? They can put your patient into the possibility of bleeding. Okay? Kasi nga, he or she is receiving a, anong therapy na ulit? Sorry, nasa na tayo? And thrombolytic medication. So, IM injections are to be avoided as much as possible in order to reduce the risk of bleeding at the site of injection. Of course, there are other interventions that needs to be reduced or avoided if your patients are receiving thrombolytic medications. Okay? Yan. Next, we proceed to number 33. Medications are also prescribed to address specific infectious and parasitic diseases. The genus Plasmodium is responsible for which of the following disease? Okay. Medications are prescribed to specific parasitic diseases. Plasmodium species is responsible for what type of disease? Mr. Abad?
Delta.
Yes, ma'am.
Okay, yes, malaria. Okay. So malaria is the
Malaria.
disease, yes, that is caused by this species Plasmodium. There are 4 types of Plasmodium species, ladies and gentlemen. We have your Plasmodium vivax, Plasmodium ovale, Plasmodium malariae, and Plasmodium falciparum. Of all the 4 subspecies of Plasmodium, the most fatal form is your Plasmodium falciparum. Okay? Plasmodium falciparum is associated to your human cerebral malaria. Okay? So ito yung isa sa pinaka grabeng effect ng ating Plasmodium falciparum. That is the most fatal form of malaria. Okay? Your malaria caused by Plasmodium falciparum, because a patient, if left untreated, could possibly suffer from human cerebral malaria. Plasmodium vivax is the most common type of malaria inflicting people. Okay? Mas common ito sa general population as compared to the rest of the malarial subspecies. Okay, so if you are supposed to have a let's say field duty, okay, meron kang community, let's say for example you will be working with a community wherein there is an increased incidences of malarial infection, you are supposed to take a prophylaxis. Okay, what is that medication? That is a very controversial medication actually because of the pandemic COVID-19.
Ivermectin.
Hindi. Okay, ivermectin, yes, that is a controversial medication, pero that is not the prophylactic medication for malaria. Narinig ko po yung isa. Ano yung sinabi ng dalaga? Chlorkin. Okay. We have your hydrochloroquine or your chlorkin is the medication for prophylaxis, no? For prophylaxis when you are assigned to a malaria-stricken community. So if you plan to stay there or work there for a very long time, let's say for example, yun ang plano mo, your physician, say this should be a prescribed medication. Your physician will have to prescribe you to take in your chemoprophylactic agent, particularly your hydrochloroquine or your chlorkin. Okay? Ito yung unang gamot na pinaglalaban ni President Trump, if you remember. Di ba? Against COVID-19. Ito yung i-stock daw niya na medication. Accordingly, your chlorkin, which is still a questionable medication. Yes, that is an antiparasitic medicine, pero it is not yet proven naman as to its efficacy or against COVID-19. No, wala pa namang proven studies regarding that. So if you are supposed to go to that area, you are advised to take hydrochloroquine tablets, okay, at least 1 to 2 weeks prior to exposure. And when you will be there, additional 2 more weeks. On the 3rd or 4th week, dapat makompleto mo ang buong chemoprophylaxis treatment mo. Okay, so this will at least prevent you from possibly acquiring the malarial infection. Okay, yan. Malaria. What is the causative agent for malaria? The vector, should I say? Sorry. The vector for the transmission of the disease. It's the
Anopheles.
Okay, yes, female, correct. It's the female Anopheles mosquito. So please do not interchange that with your dengue, with the vector associated with your dengue or dengue fever and for your dengue hemorrhagic fever. So that is for Aedes aegypti naman. For the rest of the choices here, trypanosoma, hepatitis B, toxoplasma, hindi po siya related sa plasmodium. Your toxoplasmosis is acquired or can possibly be acquired from the cat litter or feces of cats. Okay, so there will be when you will be able to ingest, most probably, this agent toxoplasma, that it could possibly cause an infection on your part, although it will not be an imminent infection, but it will have to take time muna, before your symptoms will develop. For hepatitis B, this is not viral in nature nor bacteria. This is not viral. This is not bacterial in nature, my dear classmates, and it is not acquired through skin-to-skin contact. Kasi may mga tanong about hepatitis B. So again, this is a blood-borne disease which can be transmitted in, what are the different modes of transmission for Hep B? Or anyone from the class, hepatitis B? May hepatitis A tayo na tanong, hindi ko alam kung sa pharma or sa ibang exams natin. Ang hepatitis A is fecal-oral route. Ang hepatitis B, blood-borne. In what manner could you possibly be infected with this particular ailment? So direct contact, of course, direct contact, sexually ang pinag-uusapan natin dito.
Needle.
Possible din ang, yes, Mr. Abad?
Needle.
Okay, so needle stick. So of course, contaminated needles, hindi naman yung sterile or shared needles from the legal drug users. Ayan, what else?
Saliva.
Saliva.
Shot glass.
Huwag namang saliva. No, saliva is not you cannot possibly harbor the disease with saliva lang. Okay? Baka kailangan pa natin ng gallons of saliva bago magkaroon ng Hep B. But definitely eliminated po ang saliva as a mode of transmission for Hep B. So blood transfusion is possible. Okay, that could be possible, ladies and gentlemen. Trypanosomiasis. This is your African sleeping sickness. Okay? Trypanosoma gambiense and Trypanosoma rhodesiense are the causative agents for trypanosomiasis. Okay? So this is your African sleeping sickness. Okay, this is transmitted through the bite of what? It's not a mosquito.
Fly.
It's your fly. Fly lang yung narinig ko. May mauuna pa dapat dyan bago yung fly. Is it the sandfly or the tsetse fly?
Tsetse.
Okay, very good. It's the tsetse fly. Kasi yung sandfly, it's leishmaniasis. So wala dyan sa option. So anyway, for Plasmodium, there are 4 subspecies and it is transmitted via your vector, particularly the female Anopheles mosquito. Okay? So yan. Next. Number 34. Dr. Kim Mukhtar ordered the weight to be taken daily. As the nurse takes the weight, properly, it will involve which of the following?
Wait.
Okay, what are the important details that you should know if you are supposed to weigh a patient? Is it A, B, C, or D? Or E? 5 pala yun. Okay. In order for you to get the weight of your client properly, the ideal ways should be use the same bathroom scale at same time, same clothing composition, and no footwear. So that is number 34. Okay, ito usually yung na-appreciate niyo when you were in your under 5 exposure, diba? Number 34, letter A. Next, number 35. The child of Mr. Chong Go is infected with Enterobius vermicularis. As the nurse, which of the following will be expected? Okay, do you know what is Enterobius vermicularis? It's the Mr. Aspiras. What ailment is attributed? What infectious or parasitic disease is attributed to Enterobius vermicularis? Mr. Aspiras?
I have no idea, Mama.
Okay. Who has an idea?
Pinworm.
Pinworms, very good. So Enterobius vermicularis is your pinworm infection. Okay? So what is supposed to be expected if you are the nurse among all the 4 choices except na yung none of the above? Okay, the 4 choices, mamili ka. Ano ang tamang sagot? The whole family will be treated. The whole family will be moved to another house. The whole family will be quarantined. Or the whole family will not be treated as they are not infected.
Alpha.
Sino po yun?
The whole
A.
family.
Okay, the correct answer is letter A. Since your pinworms are transmitted, how are pinworms transmitted, by the way? May we hear from Miss Anamo? Is this fecal-oral route? Can this be possible na fecal-oral route siya? Pwede rin ba siyang through inhalation? Pinworm infection is very common among children. If you share the same room, the same bed, okay, you ought to subject yourselves for treatment, all of you, okay? Because your pinworm infection, which could possibly be transmitted, which could possibly be transmitted through fecal-oral route. Pwede rin po kasi siya through inhalation because the eggs are very, very light that they can be with the air, okay? Kung nagpapagpag ka, ganyan, or let's say inopen mo ang window mo sa room mo, and then a sudden gush of air, okay, came into your rooms, ang dami-dami nyo dyan, it could be possible that you can inhale the eggs coming from this pinworms, okay? The definitive test usually that is being done, okay, microscopic pa rin naman ito. Kaya lang, at home, if you suspect yourself or your sister or any member of your family na meron siyang pinworm infection, you can do the Scotch tape test. Okay, Scotch tape test. When is Scotch tape test done? Anyone? Anyone from the class? Miss Lukotan. Are you? Oh, Miss Lukotan. How is Scotch tape test done? Bakit ko tinatanong ito? Kasi sa mga community setting, we should be at least informed on how to do the Scotch tape test. When is Scotch tape test done? Miss Rosley, you're in pala. Miss Rosley.
Hindi.
Miss Camille. Yes, Miss Samantha. Yes, Miss Samantha, you want to say something?
No. Ma'am, at night?
You do the Scotch tape test at night. Tama ba? Pagkakaintindi ko?
Yes, ma'am.
Okay, so Miss Samantha Gay says that it is best to do the Scotch tape test at night. What about Miss Hannah? Miss Hannah,
Maybe in the morning.
any idea? Early in the morning. So between the two, who agrees with Miss Samantha? Can you please virtually raise your hands? Who agrees with Miss Focasan? O Miss Focasan, ikaw lang daw. Okay, Miss Jobel, who else? Miss Pakuraw, Miss Mary Grace. Okay, so who agrees with Miss Hannah that it is done early in the morning? Okay, Mr. or Miss, sorry po, Miss Cyprine, Mr. Miss Levy. Okay, so your Scotch tape test is done early in the morning, okay? Before, kulang pa yun. Before the patient or before the suspected client will have to do washing of the private part or before the patient will take a bath, okay? So you have to perform the Scotch tape test early in the morning before the client will wash himself, okay? Because washing can actually alter the possible results. What if the patient is really positive for pinworm infection? So ma'am, am I going to do that? Yes, you are going to do that by simply getting a Scotch tape, and then the portion of the Scotch tape will be patched on the anal area of the patient, okay? Anal area. And then that will be subjected to examination. So of course, we will have to submit that sa laboratory natin. And then that will be processed now by our medical technologists. Okay, so this Scotch tape test is usually done in three consecutive days. This three consecutive days early in the morning before the patient will wash himself or herself. Okay, why early in the morning? Why not night? Why not do it at night, ladies and gentlemen? Any bright idea?
Maybe the usual thing is you defecate during the morning, but some people do it at night.
Okay, is who agrees with Miss Ruby? Early, karamihan daw naman sa atin, most of us do defecate early in the morning, but others do it at night. So does it have something to do with defecation? Thank you, Miss Ruby.
I think it's more the pinworms are more active at night, don't they? Are they not?
Okay. So that is the very reason why we do it early in the morning. pinworms are very active at night. It is the best time for the female pinworms, of course, to lay their eggs. That is why you appreciate, or your patients, if they are infected with pinworms, they usually complain, no, of anal itchiness. Okay, they keep on rubbing and they keep on scratching their rectum, their anal area, because during that time the eggs, or sorry, the females oviposits, okay? Female pinworms oviposits. Ibig sabihin, this is the time when they do lay their eggs. And yung paglilay ng eggs po, it's not 1, 2, or 3, but hundreds and thousands of eggs are being laid during the night. Okay, that is why early in the morning, this is the best time to collect samples from our patients. Okay, so that is how you do your Scotch tape test. Okay, so again, you have to submit yourselves to treatment, all of you, because you are suspects of pinworm infestation. Okay, may gamot ba yan? Of course, meron naman tayong mga antiparasitic medications. Okay, so that will be prescribed to you. Next, okay, that's number 35. Next, we proceed to 36. The client, Mr. Sanggoko's son, okay, who was diagnosed with iron deficiency anemia, is to be discharged tomorrow. He verbalized, my son will be given a liquid preparation of iron. Which of the following would be included in the discharge instructions of the nurse? Baka hindi nyo to first time na ma-encounter because this is a board exam question as well. My son will be given a liquid preparation of iron. What is your instruction as a nurse? Excuse me. Sorry po. Letter A, letter E. Alpha? Okay. Correct. The answer is letter A. You have to teach and or instruct the parents that the child will use a straw for the liquid preparation of iron. Why? Because this medication could actually stain the teeth, and using the straw would minimize the likelihood of staining the teeth of the child. Okay, that's number 36. Next, 37. The following are safety measures during drug administration, but one. Okay, all of those are safety measures except for one, and that is letter D. Okay, D. The nurse. Okay, very good. Delta. The nurse will not check the doctor's order or medication sheets. All the choices A, B, and C are a must, for you to do when you are administering the medication. Please, kahit very minimal na lang po yung ating hospital exposure, please do not forget the different R's in drug administration. So of course, you have to check for the doctor's order, including the dosage, etc., etc. Okay, before you administer. If you are in doubt of the medication, better refer back to the doctor's orders sheet and the medication sheet. Okay, especially so if your patients would be telling you that parang na-discontinue naman na po yung gamot ko na yan. Sinabi ng pasyente. You can double check it by going back to the patient's chart, particularly double checking it using the doctor's orders sheet and together with the medication sheets. Okay. Next, number 38. Which of the following will be the body's response if an anticholinergic drug is administered? Say, paulit-ulit sa anticholinergic. So what is the best answer? There would be, since direct acting ito sa ating gastric area, apart from the respiratory system, there should be an expected decrease of gastric acid secretion as well as a decrease or a slow intestinal motility. Okay, so that is letter B. Okay, so yan po ang expected side effects for anticholinergic drug when given. Next, number 39. Mr. TikTok has been vaccinated of HAV vaccine, okay, Harvix for hepatitis A. The student nurse is aware that the primary mode of transmission for Hep A is skin-to-skin contact. Hindi po. Fecal-oral route is the correct answer. Okay? Fecal-oral route is the correct answer. Okay. So, sharing of used needles and sexual activities, hindi po transmissible sa hepatitis A, sorry. virus through this means. So direct skin contact, sharing of used needles through sexual activities, not for hepatitis A. It's letter B, fecal oral route. So this usually happens if an uninfected person will ingest or may have ingested food or water that has been contaminated with the feces of an infected person. Okay. So kung hindi ka sure sa mga, okay, again, I'm not against the street vendors or the ambulant vendors, no? But if you are not sure of how the food was prepared, better not eat those foods. Okay? Next. Tama? Kung hindi ka sure, huwag mong kainin. Eh, lalo na if kaduda-duda naman yung itsura pa lang ng pagkain, eh, parang there's something it eat that you might not want to suffer from. Okay, so that's number 39, fecal oral route. Number 40, for clients with Hashimoto's disease, the drug levothyroxine is given. So Hashimoto, is this a hyperthyroidism or hypothyroidism type of problem? Hashimoto's disease. Anyone from the class? Hypothyroidism. Okay, so hypothyroidism. So Hashimoto's disease is a form of a hypothyroidism. The drug levothyroxine is given at which of the following time? Okay, by the way, your levothyroxine is a medication of choice to treat this type of condition, hypothyroidism, and even goiter. Yung goiter, that is the enlarged thyroid gland. There is a very visible, no, formation or enlargement, of your thyroid gland if you have this goiter. Okay, so levothyroxine is one of the treatment of choice. Okay. So what is your answer? When is the best time to take your levothyroxine?
Before meals.
Before bedtime? Hindi po bedtime, madam. Yung isa, hindi po. Hindi po siya before bedtime. Okay, ano ba ang bedtime natin? Umaga. Charot. Okay. Okay, so for the answer, yes, number 40 is letter E. Tama po si madam na sumagot na isa. Before meals on an empty stomach. Why empty stomach? Because this will give you a better efficiency and effectiveness, especially sa absorption ng medication if it is taken before meals. Okay? So it will be before meals. Yan po. Next.
Google, ano better absorbed at night, kaya bedtime.
Was, madam. It should be given before meals on an empty stomach. That we, ang sabi pa nga, it should at least be the same time. Okay? Every day, dapat the same time daw for better absorption, efficiency, or effectiveness of the medication. Yun po ang sabi ng libro. Kaya okay, sabi natin. Si Mr. Google, baka second choice na lang siya.
I actually take that medication, but I take it any time of the day.
Bakit ka merong ganun, madam? May problema ba tayo sa madam?
Ay po, yeah.
Really? Oh, sana naman hindi sa akin. No? Oo, ayan, hypothyroidism. But you are very blessed that you were able to at least have one child, di ba? Kahit pa paano, kahit meron tayong problem on the thyroid gland. Or not unless ngayon lang yan?
No, ma'am, it's prior to
Pregnancy.
I had di ba I have tumor on my pituitary gland. After that, then they gave this to me.
Okay. Pero at least meron kang isang baby boy. Tama ba?
Yes, ma'am.
You are blessed with one child. Masaya na tayo sa mga ganyang labanan. Diba? Oo. Naman, next. Number 41. Ayan. Ano lang yon? Admit. 41. For which of these drugs is the following true? Post-op vomiting is uncommon with this IV agent. And patients are able to ambulate sooner than those who receive other anesthetics. So asan sa mga anesthesia na nandyan sa limang yan, pwede ka nang umalis pagkatapos, pwede ka pang maglakad, pauwi. post-op vomiting is uncommon in this IV agent, intravenous agent, and patients are able to ambulate sooner than those who receive other anesthetics. Anong IV anesthesia yan? It is your
Morphine.
propofol. Okay, letter B. The answer here is propofol. Okay, your propofol, okay, take this down if you are writing your notes. So propofol has an anti-emetic property. Thus, post-operative vomiting is uncommon upon using this intravenous anesthesia. It is also the anesthesia, okay, of choice for ambulatory surgery. Okay, for ambulatory surgery. So, yeah, yun lang naman ang sinabi about sa propofol. So, the best choice here in number 41 is letter B. Okay. Next, number 42. The Cell and Coombs classification system categorizes allergic reaction and is useful in describing and classifying patients' reaction to drugs. Type 1 reactions are immediate hypersensitivity reaction and are mediated by what? Immunoglobulin. Number 42. What is your answer? Bravo. Okay. So in any type of sensitivity reactions, hypersensitivity reactions or allergic reactions, it will be the immunoglobulin E which is active, which are activated. Okay. So for IgG, okay, for IgG, this is capable of IgG, usually 70 to 75% composition sa ating plasma cells. No? We have our IgG, one of the major immunoglobulins. Yes po. Okay, so wala naman po. Your IgG, your immunoglobulin G is the immunoglobulin that can actually stop placenta. This is the type of immunoglobulin that nati-feedback tayo. Okay, this is the type of immunoglobulin that crosses the placenta. Okay? So, ibig sabihin, ito po yung first protection ng ating developing embryo while it is inside the womb of the mother. So this is the immunoglobulin that your mother can actually pass to the developing embryo. Wait lang. Nag-feed ako ba yun?
Grace, tama
Si Miss Buwan. Sorry. Oo, si Miss Grace pala. Okay. Ayan. So balik tayo sa ating presentation. So again, IgG, this is the immunoglobulin that can cross the placenta. So this is the very first immunoglobulin that these fetuses or unborn child could receive from their mothers. Okay? Your IgA, okay, or your immunoglobulin A is the second most common serum that is found in our own secretions, particularly your saliva, tears, and mucus. Your immunoglobulin A is also associated with the breast milk, no, coming from our breastfeeding mothers. Okay, so it is passed through the first milk. Ano po ulit yung first milk natin coming out from our breasts, ladies? If you are a mother, syempre, anong tawag natin doon?
Colostrum.
Okay, so we have your colostrum. Again, it is associated with your immunoglobulin A. Ayan, huwag niyong kakalimutan yan kasi nasa mga board exams yan. And of course, your immunoglobulin M, which is the third most common serum immunoglobulin. So this type of immunoglobulin is the first, okay? This is the first immunoglobulin to be made by the fetus, okay? Bakit? Of course, when he or she will soon be exposed to infectious agents or pathogenic microorganisms, that your immunoglobulin M will be activated. Okay? So in any, for every new type of infection, your immunoglobulin M is activated. Okay? Immunoglobulin M. Yan. So at least you know na po what are your immunoglobulins. Your D, sa surface, they usually bind. This is the least commonly encountered immunoglobulin. No, though they usually attach themselves to the surface of our B cells. Okay, if my memory is right, your B cells they are very responsible in attaching themselves as surface in the surfaces of antigens. Okay, yan sa B cells naman po sila. This is the least understood immunoglobulin. Okay? Though they still have a role in terms of the immune system of an individual. In the clinical setting, okay, you have been there for how many times already? If your patients are subjected for this test, serum test, blood serum test, diba? We are usually seeing results of IgG and IgM. Ito yung common immunoglobulins that you can see in lab results as to the or when considering the exposure of a person to a particular infection, kung ito ba ay bagong klase ng infection or is this a chronic type of infection? Because when it comes to the exposure to specific infectious diseases or pathogenic diseases, okay, tawag nito, your immunoglobulin, if your immunoglobulin G, if you have been encountering this disease on and off, you expect that there will be an elevation of your immunoglobulin G. Compared to a new type of infection, that this immunoglobulin M will be elevated if this has been encountered by your body for the first time. So ito yung very common na nakikita ninyong immunoglobulins that are in the lab result forms of our clients. For immunoglobulin E, yes, for hypersensitivity reactions, you can also see that in the area. Yan po. Okay, so that's number 42. Number 43, Dr. Altera orders 250 ml of PAC-RBC for a patient. This therapy is administered for the treatment of what is the disease or the condition, the condition that the client is in. That is why he or she did receive PAC-RBC or PRBC 250 ml for infusion. The answer is thrombocytopenia. Thrombocytopenia. Okay. Hello? Okay. For thrombocytopenia, hindi po yan ang problema ng pasyente natin. Okay, because when you say thrombocytes, these are your platelets. Hyperactivity is eliminated. Hypoalbuminemia, a decrease in your albumin levels, will not be addressed by your PAC-RBC administration. Leukopenia, white blood cells, it will not be addressed by your PRBC. So the best answer here, ladies and gentlemen, is your anemia. Okay? Next, number 44. Nurse Kimi is aware that patients who are allergic to intravenous contrast media are usually also allergic to which of the following products? Intravenous contrast media. Anyone?
Dog, ma'am.
Sorry. Delta? Bravo.
Delta.
Delta.
Okay, Delta. Because some of our contrast media, okay, when our patients are subjected to those types of diagnostic procedures, most of the content is made up of iodine. Okay, so it's made up of iodine. So the most, the prominent ingredient, no, when we talk about this contrast media is iodine. So when you are taking the history of a patient with regard to any allergies, okay, and your patient is to be or should be undergoing such a test, considering the use of intravenous contrast media, you have to ask if they have an allergy with shellfishes. Okay? Next, number 45. Pag eggs kasi, eggs naman, it's most common, no? na dapat nating itanong kung may allergy yung patient sa egg, kung vaccines naman yung ibibigay natin. Okay? Naalala ko lang. Kung vaccines. Okay? Yung ibibigay natin. Because there are some vaccines, since they are, what do you call this? They have this substance, no? That is in it that causes an allergic reaction. So protein kasi yung mga vaccines natin. And your egg is a good source of protein, just the same. So we usually ask our patients if they have a previous reaction, allergic reaction towards vaccine. Kasi baka mamaya, one of the components of the vaccine is actually causing the allergic reaction. Okay? So hindi po yan applicable for intravenous contrast media. Again, that should be shellfish. Number 45, Nurse Anna, to me, is aware that the IVF solution routinely used to flush an IV device before and after the administration of blood to a patient is sterile water. Correct?
C.
Letter C, very good. So 0.9% sodium solution or your normal saline. So again, why is this so? Because this particular solution has the same osmolarity with your blood and of course your bodily tissues. Okay, so this will not cause lysis to your red blood cells. Okay, so again, the correct answer is 0.9% sodium chloride solution. Okay, so ito, number 46 to 50. Okay, you will select your answer from the choices there at the box, inside the box. Okay, this is the clinical measure of drug safety. What is your answer here? Drug safety. Okay, the correct answer here, ladies and gentlemen, nakikita nyo ito sa mga drug handbook nyo, pero minsan kasi we fail to, read it or go through it. Okay? So number 46, this is a clinical measure of drug safety. That is your delta, therapeutic window. So this is a useful index of safety when we are talking about these medications. So the window in between the dose for in the drug causes therapeutic effect. Okay? Therapeutic effect, including those which is toxic. Okay, so the correct answer in number 46 is delta, therapeutic window. Next, number 47, the dose of the drug that reaches the systemic circulation. So take note, systemic circulation. Dose of the drug that reaches the systemic circulation is your letter E. Bioavailability. Okay, so bioavailability is the fraction of the administered dose that reaches circulation. So this is the extent to which your drug or the administered drug is absorbed and transported to the target tissues. Okay, so that is your bioavailability. Next, number 48. This concept predicts the time course of falling drug levels after administration is stopped. Okay. What is the time course of falling drug levels? That is your half-life. Half-life. What's a choice ko half-half? Half-life ito, okay? So it is the time needed to change the amount of drug in the body by 1/2 or 50%. Okay, so 50% of those medications stays in you and the 50% is eliminated. But we are sure that the state for the maximum therapeutic reaction has been attained. Okay? So that is letter C, half-life. Number 49, the dose required to achieve a specific plasma drug concentration level with a single administration. A single administration. Ano po yun? Dose required to achieve a specific plasma drug concentration with a single administration. That is your loading dose. Okay? Loading dose. You've been hearing this, lalo na sa mga antibiotics, when we are giving antibiotics pre-op, the physician usually orders a loading dose of specific antibiotics prior to surgery. So this is a single dose given to our patient. So, rapid acting ang mga ito pag loading dose. Next, number 50, the dose required of regular administration to achieve a target plasma level. Regular administration is the keyword required for a regular administration. That is your maintenance dose. Okay? Maintenance dose. Yan. Next, number 51. Okay, cimetidine. Naglagay ako ng isa. Plus ranitidine are examples of what histamine blockers. There are only two. Okay, histamine blockers. We have your H1 and H2. Correct? So, in particular, what category do these drugs fall? Is it H1 or H2?
Bravo.
Bravo, very good. So histamine receptor 2. Okay, so H2 receptor antagonist ang ating ranitidine and cimetidine. So this will help at least gastric acid production or secretion from our stomach parietal cells. Okay, so because the parietal cells are the ones responsible for the release of this gastric juices, particularly your hydrochloric acid. Okay, so parietal cells. Yan, H2 receptor antagonist po. H2 receptor, H2. Okay, correct. Next, number 52. Nurse Long John is caring for a client with hyperparathyroidism and notes that the client's serum calcium level is 13 milligrams per DL. 13 milligrams per DL. Which medication should the nurse prepare to administer as prescribed? As prescribed. So 13 milligrams per DL ang kanyang serum calcium levels. Mataas, mababa? Mataas. Okay, mataas masyado yung ating 13 milligrams per DL. So what is the medication of choice? It's your calcitonin. Very good. Calcitonin. Alam kong na-encounter nyo to sa MS. Okay? Calcitonin. So the normal serum calcium level, okay, the normal reference ranges, no, for a serum calcium is from 8.6 to 10.0 milligrams per DL. Again, baka nagbigay ako ng data dito. Please, data na baka iba sa nasa hospital. Please take note that there are different tools, no, or reference ranges that they make use of depende sa kung anong klaseng device or tawag mo dito. Basta, yung ginamit nila doon sa area. So please take note of the reference ranges. But sa notes ko kasi, the normal serum calcium levels is from 8.6 to 10.0. So the 13 milligrams per DL is too high for the patient. Therefore, we can say that the patient is experiencing hypercalcemia. Okay? Hypercalcemia. So in hypercalcemia, large doses of vitamin D needs to be avoided. Okay? Hindi natin kailangan yan. Calcitonin, a thyroid hormone, okay? A thyroid hormone decreases the plasma calcium levels. That is why the drug of choice na pwede natin ibigay sa patient natin is calcitonin. Again, this is a thyroid hormone that decreases the plasma calcium levels. Okay? How? By inhibiting bone resorption and lowering the serum calcium concentration. So of course, kung hindi mo na-absorb yan, malamang hindi tataas ang calcium levels mo. So that is how your calcitonin will work on the case of your patient. Okay? Next. 53. Oral iron supplements are prescribed for a 6-year-old child with iron deficiency anemia. Pag iron deficiency anemia, this can be managed by modifying the dietary intake of the child, okay? As compared to other types of anemia. Iron deficiency is more related to dietary intake. So we can actually resolve this one, no? So oral iron supplements are prescribed for a 6-year-old child with iron deficiency anemia. The nurse instructs the mother to administer the iron with which best food item? So this is best absorbed. Your iron is best absorbed with milk, green tea, water, apple juice, or orange juice.
E.
Orange.
L, letter E. Because the absorption of the absorption of iron is increased with vitamin C. Okay, so kayo, if you are taking in iron supplements, please make sure that you partner it with vitamin C. Pwede naman yung pharmaceutically prepared vitamin C, or you can just simply have this organic ones. Meron kang orange juice, then you may do so. Okay. Ma'am, bakit hindi na lang apple? May vitamin C din naman yun. As to concentration, my dear classmates, orange juice or the oranges have a higher percentage or concentration of vitamin C compared to the apple. Okay? So the best answer still is letter E. Okay. Next, sulfamylon is prescribed for the client with burn injury. When applying the medication, the client complains of local discomfort and burning, burning sensation, so medyo mainit. Which of the following is the most appropriate nursing action? You have to notify na ba si nurse supervisor? Apply a thinner film than prescribed. So parang nag-underdosaging tayo. Discontinue the medication or inform the client that this is normal.
E.
Letter. Inform the client that this is normal is the correct answer. Okay? Why? As part of the component of your sulfamylon, we have this mafenite acetate, which is bacteriostatic, okay, for a gram-negative and gram-positive bacteria. Remember that the skin of the patient has been damaged because of a thermal injury. So meron siyang burn injury. So in order to reduce the amount or number of bacteria that is present in those avascular tissues, your skin, the administration of sulfamylon is advised. Okay, so you should inform that the medication will actually cause a local discomfort. Ano yun? Yun na po yung there is heat or there is anong letter? Burning sensation. So medyo mainit, okay? Medyo mainit yung medication, and that is expected to be a normal reaction. So there is no need for you to go to your nurse supervisor and report it na there is a little discomfort and warmth being felt in the area. Again, this is a normal side effect. Okay, so there is no need for you to panic. Next, number 55, Mrs. Tina Bayaan has been prescribed with guaifenesin or robitussin. The nurse realizes that the drug functions to robitussin. Functions to what? Stimulate alpha-adrenergic receptors producing vascular constriction of capillaries is a questionable choice. To compete with histamine for receptor sites, thus preventing a histamine response, is not an option. Okay, between B and C, what is the correct answer? Between B and C.
Sorry.
Hindi ko nabasa, may motion sickness pala dito. Mali ang letter B. Letter C is the best answer, to loosen bronchial secretions so they can be eliminated by coughing. By the way, is coughing considered a disease?
No.
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 Okay, it's a normal reflex from us in order to eliminate or expectorate the presence of foreign bodies, foreign substances that are within our tracheobronchial. Okay, so that's number 55. 56, an appropriate nursing diagnosis for clients who are taking NSAIDs and anticoagulants would be which of the following?
Which?
Nagte-take siya ng non-steroidal anti-inflammatory drugs plus anticoagulant. What could be the most appropriate nursing diagnosis that you can formulate?
Injury.
NSAIDs are usually associated with gastric ulcers. Tama? Tama ba?
Yes, ma'am. Tama.
For long-term
Yes.
users, or for long-term or people who are using NSAIDs for a very long time, candidate tayo. O tayo, sabi ko kasi I'm using NSAIDs. Okay? Hindi po arthritis. Yan, migraine lang. Okay, but that the NSAID is, I could say that that is the best medicine for me na. Walang bayo-bayo, Jessie. Ayan, so if you are a long time user of NSAIDs and user ka pa, or yes, you have been taking in medications that are classified under anticoagulants, you are high risk for injury. Correct, alpha. Risk for injury related to prolonged bleeding time because that could possibly happen kasi nga nag-anticoagulant ka. Inhibition of platelet aggregation, yes, that's true. And a risk for GI bleeding, okay? Because of this, the relationship of this condition to your long-time usage of NSAIDs. Yan. The rest is history, okay? But the best nursing diagnosis that you could formulate is letter A. Because with all these drugs that are being taken in by your patient, nasa letter A na po lahat ng risk problems. Okay? Next, number 57. Which of the following group of clients are most at risk for GI bleeding from the use of NSAIDs? At risk for GI bleeding. Risk lang, hindi ko sinabing meron ka na. But you are high risk of GI bleeding from the use of NSAIDs. Who among the clients below?
Delta.
Delta, very good. Clients with arthritis. Again, your NSAIDs are anti-inflammatory. They have an analgesia effect. Therefore, arthritis is the best candidate now for the risk of developing GI bleeding in the long run. Next, number 58, absorption, distribution, and excretion may be increased by which of the following diseases? Absorption, distribution, and excretion are increased by which of the following diseases? Liver, hyperthyroidism, renal insufficiency. Which among the conditions?
Hyper.
Good health. Okay, very good. Hyperthyroidism. Okay, hyperthyroidism. Next, number 59. Bibilisan na natin. Drug safety is determined by the degree between what? Okay, drug safety is determined by the degree between therapeutic and toxic doses. Very good. That's number 59. Therapeutic and toxic doses. Yan po, drug safety. Next, the last but not the least, an expected effect of the drug is known as very easy lang ito, madam. Okay? Good. Charlie, adverse effect. Okay? So that is for your pharmacology. So for us who were able